know as prospective applicants, you have quite a tough task ahead of you trying to find your ideal training program in an unideal situation.
Our fellowship program is structured in 3 main hospitals. One private hospital, which is Tulane Medical Center. We have a veteran hospital, a VA hospital in New Orleans, which is fairly new. It was just inaugurated a couple of years ago. And then we have a public hospital that is University Medical Center that is also fairly new. And these 2 hospitals were built after Katrina. So the University Hospital was built and started working 5 years ago.
Overall, I'm very, very happy here. The people here are very supportive. The attendings, the fellows, the residents all work together like a family.
We have a dedicated faculty who are very approachable and seasoned in their respective fields.
I think they're an amazing group of people to talk to. They have a wide range pathology, and you're going to learn quite a bit from them. Here at Tulane and all the hospitals that we do operate out of, you get to take care of anywhere from the indigent population all the way to transfers from outside facilities for higher level of care.
We have been historically very strong in interventional pulmonary, and up to today we've been producing a lot of fellows who have gone into this field and gain expertise with further training. Many of them have leadership positions nationally and internationally in interventional pulmonary. So a typical week of our fellows' schedule varies depending on the rotation they are at. The ICU rotations tend to be more demanding, and there's plenty of patients given like our 3 different populations we serve. We pretty much see everything on these ICU rotations. Obviously, in the last months with COVID, there's been a huge increase of the needs of critical care, and that's it's been actually a great experience for our fellows.
This place has a good balance between education and clinical work. And I have never felt overwhelmed at any time.
So our program is especially in several ways. Patient population, the possibility of pretty much experiencing every single field of pulmonary critical care medicine with experts in every single of these fields. Also, the opportunity to tailor their training based on their career objectives. Including clinical care, research, or medical education.
Just recently, the program actually invested in portable ultrasounds for the fellows, so we're being currently trained in critical care ultrasonography.
We have a great faculty with a lot of expertise in each part of our field. We have a lot of good resources in terms of clinical training and research. Tulane is a great place because of the camaraderie between different departments and the opportunity to do research with even people that are not specifically part of our faculty. There's a great mentoring from people who have been around for so long, and the junior faculty brings also a lot of passion and energy to all of our new endeavors.
Our attendings are amazing teachers. I've, throughout all this time, felt like I've had a good level of autonomy and decision-making capacity, but also had enough education from them to make sure that I'm growing my own practice and growing the way I want to practice.
Our culture is to treat everybody as a colleague. We are on this as a team. We all learn together, we all grow together. And this close relationship with our trainees, fellows, and residents have actually made us grow a lot as well as faculty.
But one of the more amazing things is just seeing previous graduates here as well, also chiming in and giving us their input. To me, it speaks a lot of the culture that we are building and the culture that we have, and it's something that I appreciate and I'm happily willing to contribute to.
So we're always looking for fellows who are interested in making a difference in the community. We live in a city that still have a lot of things that could be done better, that our patients probably will benefit of leaders in the field of making things more just in terms of healthcare delivery. There's something very seductive in the city, and it's probably the part of the mix of several cultures that have happened in these 3 centuries of the city that have come up with a great music, great food, but most important than that, great people. people that have a sense of community.
And if you love good food and good music, then obviously this city is the place to be.
I think New Orleans brings a lot of opportunities, even if either if you're single, if you have a family. There's plenty of outdoor activities to do. As I said, there's a lot of music for the ones that we love music, but it's great, the people of New Orleans and Louisiana. It makes you feel home, it makes you feel part of this community, and for many of us, once we made it here, we don't want to leave.
One of the greatest cities in the United States. It's quite unique in how it's built and how it's run.
I think this is a wonderful place to learn and to hone your clinical skills. And I mean, I'm so glad I matched here. This was my number one choice.
I think this is an awesome program. I'm looking forward to the rest of my training and to work with more people here.
I do think here in Tulane, you're going to get great training. You're going to live in a place where you're going to feel comfortable, and hopefully you choose this as your place to do your training.